Recording in progress.
So sorry, you guys.
Well. She's coming to the market pad. Oh, okay, yeah. Thank you. Look at it. Did you need wine? Was this for years? Oh, okay. Thanks. Yeah. I'm not such a rock. Yeah. That's right. Thank you for coming. One more video for you and next. Sure. Thank you. No, she put it on. Oh, please no. Yes.
Hello. Yeah, I can't hear you.
We're about to begin, so if everyone on Zoom could mute your mics, and I'm going to turn it over to Davina. How many people do? 30.
Yes, I can introduce this.
Well, good morning.
Oh, that's Ryan.
That is Ryan. Mine have a story. Hey, Deanna.
Yes.
Mhm.
Hey, Deanna.
The wrong name, DM.
Hey,
We're about to begin. If everyone on Zoom could mute your mic. Davina's about to take it over and kick us off. So please remain muted during the presentation. And when we have Q&A, I will come over and let y'all know.
that's fine with me because we're gonna tell our story. My story. I have a big story.
Yes, sir. So for the presentation, just please remain muted, okay?
I will. Thank you. Deanna know my story.
You see if she's green. My friend Chelsea was there. For their pickup service. She said it was I mean, I had like something to do. Yeah.
All right, everyone. So good morning. I'm Davina Patterson, Executive Director of Disability Resource Network, and I want to welcome you to the State of Disability. We are so thrilled to have Maria Town, CEO and President of American Association of People with Disabilities, join us to present a state address on the current state of disability. The purpose of this meeting is so that our community will be informed and receive accurate and the most recent updates and information. We do have closed captioning and we have ASL interpretation. This meeting will be recorded and posted on Zoom. So if you want to go back and review it and look at it, you'll have the opportunity to do that. If there's any accommodations that you need, please feel free to reach out to myself or our team and we can assist you. And I will turn it over to Jessica Powell, Program Specialist, and she will introduce our speaker.
Thank you, Davina. I am currently working on getting closed captioning back up. I'm not sure what happened. The Wi-Fi kicked me off. So my apologies, but we're working on that. Thank you, Davina, for introducing me, and thank you all for joining us for the State of Disability. Like Davina said, my name is Jessica Powell, and I'm the Program Specialist at Disability Resource Network. It is my honor to introduce you all to our esteemed speaker today, Ms. Maria Town. Maria Town is the President and CEO of the American Association of People with Disabilities. In this role, she works to increase the political and economic power of people with disabilities. Prior to this, she served as the director of the City of Houston Mayor's Office for People with Disabilities, where she advocated for the rights and needs of citizens with disabilities, served as a liaison between the mayor, city council, city departments, and other public and private entities on matters pertaining to people with disabilities in Houston, and established local and national partnerships to advance inclusion. Town is the former Senior Associate Director in the Obama White House Office of Public Engagement, where she managed the White House's engagement with the disability community and older Americans. She also managed the place-based portfolio and coordinated engagement across federal agencies. While at the White House, Town hosted an inclusive fashion show that highlighted the efforts of makers and designers to enhance disability integration. Prior to this, Town was a policy advisor at the Department of Labor's Office of Disability Employment Policy. While at ODEP, Town led and coordinated numerous efforts to improve employment outcomes for youth and young adults with disabilities. She has particular expertise in areas of youth development and leadership and promoting college and career readiness for all youth. In addition to her disability policy work, Town is the creator of the popular CP Shoes blog, where she writes about fashion, design, and disability. She was recently named to the Susan Daniels Disability Mentoring Hall of Fame and to the inaugural class of Emory University's 40 Under 40. She hails from Louisiana, where her family still resides. We are honored to welcome Miss Maria Town to Huntsville to give us a much-needed update on the state of disability in our country. Please join me in welcoming Miss Maria Town.
Thank you so much for that kind introduction. I'm gonna wait to get started till we have the captions going so we can make sure it's accessible. Okay. I'll let you know if I do. Okay. Do test. Test, test. Yep. Thank you. Sorry about that. All right, now that we have our captions going, thank you to the captioner. I'll get started. So good morning, everyone. I'm so thrilled to be here with all of you today. Thank you for being with us this morning. For folks online, thank you for being online with us. While this event is in Huntsville, we have people from across the country who are tuning in. So for some folks, it's very early, and I really appreciate everyone's time. As Jessica mentioned and Davina mentioned, my name is Maria Town, and I serve as the president and CEO of the American Association of People with Disabilities, or AAPD. For a self-description, I am a white woman with short brown hair. I'm wearing dark red lipstick, some shiny pearls, a green dress, and Chuck Taylors. And I really want to thank the Disability Resources Network for having me, especially thanking Davina, all of the Disability Resources Network staff and board members for the incredible work that they do to improve the lives of people with disabilities every day. Now, I wanted to actually start by telling you all a little bit about AAPD. AAPD is a national cross-disability civil rights organization focused on advancing the political and economic power of the more than 70 million disabled people in the United States. And as we get started today, because we have such a diverse audience with different levels of experience and expertise, I'm going to spend some time talking about definitions to make sure that we are all on the same page. So, what do we mean by disability? Okay. In 2025, 35 years after the passage of the Americans with Disabilities Act, one of the questions I'm still asked most frequently is, what is a disability? The second question I'm asked most frequently is, am I disabled or am I disabled enough? And if you're asking yourself those questions, the answer is yes. The answer is never no. But at AAPD, when we talk about disability, we are guided by the definition of disability that is included in the Americans with Disabilities Act, the ADA, Okay, thank you. The ADA defines disability as a physical or mental impairment that substantially limits one or more major life activities. What's a major life activity? A major life activity can include processing information, speaking, eating, sleeping, learning, walking, communicating, or taking care of yourself, and more. So this includes mental health conditions, rare diseases, cancer, intellectual disability, mobility impairments, and more. It's incredibly broad. The ADA definition of disability also includes people who have a record of such an impairment. So even if you are not currently experiencing symptoms of a disability, but you have in the past, guess what? You're protected by the ADA because you have a disability. Finally, it includes people who maybe don't have disabilities but might be perceived as such. One of my favorite definitions is if you have a large birthmark on your face and a hiring manager does not hire you for a customer service job because they assume you can't do it, they're discriminating against you on the basis of disability, even though you are not disabled and you are still protected by the ADA. The ADA also makes it unlawful to discriminate against a person because of that person's association with someone, with a person with a disability. So what are some things that you notice about this definition of disability? I've said it already, it's huge. It is a giant umbrella definition that covers many, many people with all different kinds of experiences. And this is because the policymakers who worked on the ADA, the elected officials who passed it and signed it into law, and the advocates who demanded its creation and passage recognized that disability is a natural part of the human condition. They also wanted as many people as possible to benefit from the Americans with Disabilities Act. You'll also notice that the definition of disability does not include the word diagnosis, nor is there a list of specific conditions that count as disability. Instead, the definition talks about any kind of condition that affects how you interact with the world. And this means that the definition of disability is always evolving. As the way that we interact with the world changes, and as our understanding of the human condition changes, our definition of disability shifts and grows. And that's not a bad thing. So when I say cross disability, what does that mean? Cross disability means that AAPD and Disability Resources Network does not focus on a specific disability experience or type, but rather tries to engage in issues that impact people with disabilities broadly. One of the beautiful things about the disability community is that there are so many shared experiences across a range of access needs. Sometimes these shared experiences are born of frustration. Think about the amount of energy that any of you have lost by having to ask for accommodations over and over and over again and not having those access needs met. And that experience is common whether you're asking for something like sign language interpretation or asking for large print. But sometimes our shared experiences are about joy and the creativity of designing what works for us. For example, a remote work environment might make meetings more accessible for someone who is hard of hearing because of the greater availability of captions. And remote work might make it possible for someone to work from bed if they have a chronic illness. Two vastly different experiences that are rooted in the same need for something different and served by the same solution. Historically, disabled people were not only segregated from mainstream society, we were segregated from one another. There were institutions for people with intellectual disabilities, institutions for people with mental health disabilities, and institutions for people with physical disabilities. And if we weren't in an institution, we were kept away at home. This was a way of dividing us from one another. And in dividing disabled people from one another, it divided our power. our power to create collective change to advance the solutions that we need to thrive. Passing the Americans with Disabilities Act took enormous collective power from across the disability community, and AAPD and many other organizations were founded to continue to maintain and grow that power after the ADA was passed. Today, the stakes for disabled people are high. There's a lot on the line. There's a lot of changes that are negatively affecting our lives, and people with disabilities are working together in new ways to try to meet this moment and grow our collective power. AAPD is also disability led. So again, thinking about the past, many organizations that worked on disability issues were not led by people with disabilities themselves. This caused huge problems, continues to cause huge problems, like dehumanization and paternalism within disability policy. So our staff, our team are all people with disabilities. We all have different disabilities. And even folks who have similar disabilities on our team have different access needs and preferences. So now that I've spent a lot of time going over some definitions and introducing AAPD, I want to see who's here to spend some time introducing you. So in this room, how many folks are disability self-advocates? Awesome. How many people are disability allies? Hopefully everyone's hand goes up in that. How many of you run businesses? Couple people. How many of you are a sibling or a parent advocate? Right. How many of you believe that we should be working towards a community, a nation, a world where everyone has an opportunity to live with dignity and self-direct their own life? Amazing. And I'm sure I'm seeing a lot of interaction online, lots of emojis, and I'm sure there are other expertise in this room and online, whether it's academic, maybe you work in community services or recreation. But part of why I'm asking these questions is because the reality is it takes everyone to make positive change. We all have a role to play, no matter where we are positioned in our lives. Now, when Davina asked me to come to Huntsville, one of the things that she emphasized that I talk about was data. And there's a lot of disability data out there, but it can be hard to find. So let's get into some numbers. An accurate count of people with disabilities plays a vital role in determining the distribution of public resources. So the numbers that I'm going to mention have real importance because it determines things like how much money a state gets for Medicaid services. It determines things like emergency planning resources in counties and towns. It's also important for disabled people to know that we aren't alone. Even if you grow up like I did as the only person in your family with a particular type of disability, I can look at the numbers and say, maybe there's no one like me right here in Hammond, Louisiana, but there are lots of other people like me in many other places. So to be counted is to be acknowledged. And if you are counted, it makes it more likely that you're going to be supported. The data on childhood disability specifically varies a lot because we have so many different ways to assess kids. But on average, 1 in every 5 children in the US has a disability. And I've already mentioned this number, but according to the Centers for Disease Control and Prevention, more than 70 million American adults have disabilities. So that's more than 1 in every 4 adults. And in many states, like Alabama, that number is even higher. Roughly 1 in 3 adults in Alabama have a disability. The states with the highest prevalence of disability per capita are West Virginia, Arkansas, and Oklahoma. In these states, close to 40% of their adult populations are people with disabilities. These 3 states reveal another really important trend. Rural areas tend to have a higher prevalence of disability. And this speaks to a host of issues, particularly around things like consistent access to healthcare. The states with the largest number of people with disabilities are California, Texas, and Florida. These are also some of the most populous states generally. Because disability, again, is a natural part of the human condition, states with big populations are going to have big populations of disabled people. But no matter where, people with disabilities make up a significant population in every state in the nation, and we make important contributions in every single community in this country. Now that we know some of the general information about the prevalence of disability in the United States, what does disability look like and feel like on a daily basis? The most common disability in the United States are non-apparent disabilities. Disabilities that involve difficulty with cognition, concentration, learning, remembering, or making decisions. Those numbers are growing because of things like brain fog due to long COVID. So 14% of adults identify as people with those types of disabilities. About 12% of adults have a mobility disability. 8% of adults have a disability that affects their ability to live independently. Around 6% of adults are deaf or have serious difficulty hearing. Close to 6% of adults have difficulty with vision and even seeing with glasses. And then close to 4% of adults have what's called a self-care disability, which involves difficulty dressing, bathing, or feeding yourself. Now, across different demographic groups like race and gender, Native Americans and Alaskan Natives, tribal communities have the highest rate of disability, with 3 in 10 Native people experiencing a disability. 1 in 4 Black or African American people have a disability. 1 in 5 white people have a disability. And then for Native Hawaiians or Pacific Islanders and Latinos, 1 in 6 within those communities have a disability. And interestingly, for Asian Americans, 1 in 10 people experience disabilities. In every racial group, no matter what, women experience disability at higher rates than men do. And a lot of people attribute this to women's longer life expectancies because disability occurs naturally with age. Although it may sound surprising, I like to say everyone will become disabled if they're lucky. Because if you become disabled, it means you've lived a good long life. You've gotten to be a ripe old age. You know, hopefully you're either hanging out with your grandkids or telling people to get off your lawn. Either way, that's something I want. But the reality is aging is a privilege. Far too few of us actually get to do it. And if you get to become a senior citizen, more likely than not, you're a person with a disability, as half of everyone over 75 has a disability. I actually think that number is higher. But how many of you have an older adult who says, oh, I can hear, I just don't hear as well as I used to, right? The direct connection between aging and disability is one of the reasons that the number of disabled people has increased in recent years. Everyone who is a baby boomer is now over 60. Maybe we should come up with a new name for that generation. No more babies in the baby boom. The oldest baby boomers are approaching 80, and the aging of what was once America's largest generation has now created a boom of disability. For people who work, for example, half of all workers with disabilities are age 65 and over. The numbers of disabled people have also, increased partially due to the COVID-19 pandemic. As I mentioned, the virus and the effects of long COVID have led to new disabilities that we're still figuring out, and it exacerbated existing ones. Experiences of gun violence and other forms of violence like interpersonal violence lead to disability and can lead to an increase in disability. And finally, disasters. Disasters are disabling. And as the United States is seeing more disasters on a more regular basis, more people with disabilities are going to be created. As an example, think about California and the wildfires and how many people are now struggling with respiratory illness and disability because of the polluted air and smoke. The final piece that I want to name in terms of numbers of disabilities and why we might be seeing an increase is because we've improved the effectiveness of diagnosis and science. Some say, we hear this a lot with the autism epidemic. We don't actually have an autism epidemic. We now better understand what autism looks like, particularly in girls and particularly in communities of color, which two communities historically who have had a really hard time getting an autism diagnosis. So the presence of more diagnosis is not a bad thing. Again, it actually signals a better understanding on our part of human diversity. I know I don't need to say this to this room or to people online, but I'm going to make it explicit. Because disability touches every community, every family, every person, even if you don't have a disability yourself, it is crucial that we all learn more about disability experiences and think about what we can do to promote accessibility and inclusion. So I've talked a lot about data, and whenever I see data, I always ask myself one question: who's missing? Who isn't being counted? And honestly, even though those numbers that I just told you are all big, 70 million people, 1 in 5 children, those are big numbers, we're missing a lot of folks. People with cyclical disabilities often don't get counted. If you're asked, do you have difficulty seeing, but your multiple sclerosis only impacts your ability to see every once in a while, you might say no, right? These questions are very yes or no, very black or white. They don't leave room for nuance. There are many people who are disabled, as I already mentioned, like many older adults, who we might include in the disability community, but who wouldn't respond to a survey asking about disability. People with undiagnosed disabilities may not have the language to think about themselves in that way. And finally, none of the numbers that I just cited include people in institutions. All of these folks, all of the millions of people I've just named, are people living in the community. So people in jails and prisons, people in state institutions, people in group homes and nursing homes are not referenced in these numbers. And all of those people, all of those communities I just named have high rates of disability. Finally, disability identity is a deeply, deeply personal thing. Some people, no matter how disabled they actually are, may never identify as a person with a disability. And different groups may have different reasons for making that choice. But if they're never going to claim the identity, then they're not going to get counted. And so we actually, in thinking about the ways that data is used to make decisions, have to always plan for more. When you're planning a party, how much food do you get? More food than you need, right? When you are going on a trip, how much fuel do you bring? More fuel than you need. Because you never know who's going to show up, and you never know what bumps you're going to encounter along the way. One of the biggest issues that disabled people face is access to healthcare. And it's fascinating to me because many people assume that healthcare and medicine are really the thing that defines what disability is. And for most people, the first time that they were ever told about their own disability was from a doctor or another healthcare professional. We talk about the medical model of disability and how significant that has been in the United States. And yet, even though people with disabilities need and use healthcare on a more regular basis, we experience significant barriers to healthcare. Most clinics are not accessible to disabled people. For example, women with mobility disabilities are 3 times more likely to die of breast cancer. That is not because women with disabilities are inherently more prone to breast cancer. It is because mammography machines are not accessible. And so women with mobility disabilities are often diagnosed much later than women without mobility disabilities because they cannot be assessed and there is not an opportunity for early intervention. Related, we recently learned that doctors have really bad attitudes about people with disabilities. Does that surprise you? No, for folks online, everyone in the room is shaking their head no, and there was an audible So in a recent study of doctors' perceptions of disabled people, almost 83% reported that people with a disability, that they think that people with a disability have a worse quality of life than non-disabled people. Only 40% of physicians were confident about their ability to provide equal quality care to patients with a disability. And 56% strongly agreed that they welcome people with disabilities into their practice. And only 18% strongly agreed that the healthcare system treats people with disabilities unfairly. Anyone who is looking at the healthcare system honestly is going to say disabled people don't get treated fairly. If you are a person who inherently believes that disabled people's quality of life is less, how likely are you to prescribe life-saving medicine? Right? How likely are you to prescribe a treatment that might help them maintain their condition? And what we found is that a lot of physicians don't. And I'm in Alabama, so I have to mention, Alabama was the first state to execute its crisis standard of care during the COVID-19 pandemic. For folks in the room, how many of you remember this? A couple people, but to refresh everyone's memories, when COVID-19 started, many states, all states actually, were concerned about what they would do if there was a strain on medical resources. That's a real problem. What do you do if you have less medical resources than people in need? So Alabama was the first state to execute its crisis standard of care, which stated if someone had a disability, they would deny them care outright. Because saving a healthier person's life was more important. And so while that was a few years ago that that happened, those are still the attitudes that disabled people are navigating every time we go see the doctor. And so I want to talk about one thing that recently changed that was done to address a lot of these things I'm speaking to, which was an update to Section 504 related to healthcare. This was a new rule finalized last year that made it a requirement for all healthcare providers to have an accessible exam table and scale. I have friends with mobility disabilities who have to go to the vet to get weighed because their doctor's office does not have an accessible scale. So accessible scales and exam tables, non-discrimination in child welfare services, so that disabled parents are less likely to lose custody of their children. It also has parameters around non-discrimination in organ transplantation. And this rule insists upon serving people in the community and not in institutions. So if you are getting out of a surgery, you're not just going to be sent to a nursing home. You will have the option to recover in the community. However, this rule is currently being fought by 17 state attorney generals. And originally their lawsuit questioned whether or not Section 504 of the Rehabilitation Act was constitutional. Thankfully, because of the advocacy of the disability community, these attorneys general have dropped their constitutional claim, but they're still challenging this new rule. However, right now, this rule exists. And so the reason I'm talking about it is because right now, everyone should have the expectation that their medical providers are beginning to comply with this rule, that they are making healthcare more accessible, that their nurses and physician assistants are getting trained on disability and the fact that disabled lives are worth living and that we can have great, amazing, fulfilling lives when we have the supports we need to thrive. We've talked a lot about data, and I want to talk about more in the healthcare context. There's a lot of fear in the disability community right now because of the way that the Centers for Medicaid and Medicare Services might use healthcare data. Right now, people work really hard to keep healthcare data private. But at CMS, which is a federal agency, they've kind of threatened to use healthcare data in a way that might make it harder for people with disabilities to get jobs, for example. So some states are fighting back. In Illinois, in May, Governor J.B. Pritzker issued an executive order that prohibits state agencies from sharing autism-related data with federal entities unless medically or legally required. And it would be great to see more states try to protect their folks. Beyond data, disabled people's access to healthcare is under huge threat right now, more than ever. The Budget Reconciliation Bill, which passed this July, or the One Big Beautiful Bill Act, is going to have devastating impacts on the disability community. The final bill that passed, and is now law, I should say, cut nearly $1 trillion from Medicaid and threatens 17 million Americans' health insurance coverage. Another question I've gotten asked a lot lately is, what parts of Medicaid do disabled people rely on? And the answer is all of it. There are some parts that are critically important to disabled people, like 1115 waivers, which support home and community-based services. But there are people with disabilities on regular Medicaid. We use it for regular health care. And these changes will remove a lot of people from their services. At least 300 rural hospitals could close immediately. At AAPD, we've already tracked the closure of 20 rural hospitals since July. And in rural communities, again, we've already mentioned, disability occurs at higher rates, and the hospital is often the only.
Just one question. You're tracking those numbers, is that nationwide or that's Alabama?
Nationwide. Good question. Often the hospital itself is the only option people have for care. Many of the cuts to Medicaid that were included in the One Big Beautiful Bill Act will go into effect at the end of 2026. And what that means is there's still time to stop them, right? While we're seeing some immediate impacts, there's still time to stop the brunt of these cuts. That's something that AAPD and many others are working on right now. One of the other ways that these cuts will occur is through establishing biannual redetermination processes. So, how many of you believe in miracles? Couple folks. I believe in miracles. You know who else apparently believes in miracles? The US Congress. Because they believe that lifelong disabilities can somehow go away every 6 months. Because that's what's going to happen. People are going to be asked to provide proof that you are still disabled or still sick every 6 months in order to keep your benefits. That's not easy. Navigating any bureaucracy is not easy. It comes with a cost, and oftentimes people don't have up-to-date documentation. And getting that up-to-date documentation requires going to the doctor, requires paying for it. more and more resources that people don't have. And if you're in an area that doesn't have public transportation and you don't drive, what are you going to do? So people will lose services not because they've been actively cut, but because they couldn't pull together the administrative documentation they needed. And ultimately it will cause a lot of harm. There are one of the pieces of this bill specifically targets cuts to the expansion population, and not every state in the United States has Medicaid expansion. I don't believe Alabama has Medicaid expansion. But in states that do, millions of people rely on Medicaid expansion. But in some states, if they have what's called a trigger law, where if there's a reduction in federal funding for Medicaid expansion, all of Medicaid expansion goes away. So even states that have more access right now will be impacted by this. There are other states that actually have Medicaid expansion in their constitution. So they can't get rid of it, but there will be cuts in funding. So what are they going to do? Another area of healthcare that's really under attack is around vaccines and scientific research. We don't know, for example, what is going to happen with the COVID-19 vaccine. They have cut significant funding from the National Institutes of Health. This means that people who are in clinical trials don't know what's going to happen to them. At AAPD, we don't do a lot of work on cure and research. Many other organizations do, but that doesn't mean that it's not important. And it doesn't mean that we don't need more work to better understand conditions and illnesses so that people can have a higher quality of life. Finally, well, there's a lot I could say on what's happening right now, but one of the things I wanted to highlight is how these cuts to Medicaid will heighten the care crisis that we are currently experiencing. Medicaid is the only insurance that will pay for home and community-based services and direct support. So home and community-based services are what allow disabled people, children, adults, older adults to live in their homes and their communities and not have to live in a nursing home or a group home. I want to live with my family that I love, right? I want to stay in my community, and HCBS makes that possible. Medicaid makes that possible. But people already struggle to find consistent care. The average care worker makes $12 an hour. Many of whom are immigrant women specifically, must work multiple jobs to make ends meet, even though the work that they are doing literally makes other people's lives possible. The threats to immigration have also heightened this care crisis because people are afraid to go to work. Folks can't get the services that they need, and it also means that immigrants are missing out on services and healthcare and food support that they are legally entitled to and eligible for. All of that increases disability. In the United States particularly, we can't actually talk about healthcare without talking about medical debt. It's not going to surprise you all that people with disabilities have significantly more medical debt than the average American. 8% of all adults have medical debt of at least 250, but many people owe more than $10,000 in medical debt, and disabled people are more likely to have medical debt, particularly people of color and people who live in rural areas in the South. And it's harder for people with disabilities to actually manage that medical debt because disabled people's experiences of poverty are so profound. Living with a disability is expensive, right? Just talking about getting your documentation for Medicaid redetermination, I spelled out a number of things that would cost someone an extra expense. We call this a disability tax. For someone who is blind, if they're using technology, It's not just about getting a computer, it's about getting their screen reading software and enlarger in order to use that computer. That comes with an additional cost that no entity covers or meets. Getting your home made accessible comes with an additional cost. Getting your car modified for adaptive driving, all of these things get very expensive very quickly. And so people with disabilities are twice as likely to be in poverty as people without disabilities. That's huge. And we like to say that disability is both a cause and consequence of poverty, right? People in poverty often have less access to regular health care, less access to consistent food or healthy food, are more likely to live in polluted areas. All of that creates disability, and excuse me, disability itself, because of ableism, discrimination, and systemic barriers, it's harder to get out of poverty. Partially because benefit programs like Medicaid and Social Security benefits have a very strict cap on what income you can have. Does anyone know what the income limit is for supplemental security income? I'm hearing a range. Y'all are right. So I'm hearing a range in the room. It's $1,600 to $2,000, and the number is in the middle there. It's like slightly more than $1,700. That's not a lot of money for someone to have, and that's not money like in one account. That's all the money you can have. That's it. My rent in Washington, D.C. is much more than that. So that income limit has not been adjusted for over 40 years. And think about how much more expensive life has gotten in that amount of time. And these strict income limits cause other issues for disabled people, like if people with disabilities who are on benefits want to get married, many times they can't because their partner's assets will get counted against them. There's another concept called a Medicaid divorce, where, if you've been married for a long time and your husband, for example, becomes disabled and needs direct support work and needs Medicaid, the only way that he can get it is if y'all divorce, so that your income doesn't count against him. How is that right? However, and this is the good thing I will say about the One Big Beautiful Bill Act, it made some changes to things called ABLE accounts. ABLE stands for Achieving a Better Life Experience. ABLE accounts are similar to 529 accounts that allow people with disabilities who receive benefits to save a certain amount without being taxed. And that money has to be used for certain kinds of expenses like housing, education, transportation, and employment. Recent changes to ABLE accounts have shifted what can be contributed to those accounts, who can contribute, and how much, so that kind of more people, like family members, can contribute to ABLE accounts in different ways. It's not all on the individual or their parents to make those contributions, and other financial tools can be used to contribute to ABLE accounts. So let's talk about, since you're talking about money, let's talk about employment. How am I doing on time?
It is 10:52. So
I'm going to keep going. Unsurprisingly, people with disabilities have much lower employment rates than non-disabled people. Our most current disability employment statistics, and these go over all of 2024, show that 22.7%, so almost 23% of people with disabilities are employed, compared to 66% of people without a disability. And so those are just people actively in the workforce. 75% of all disabled people in the United States are not in the workforce at all. And again, this is often because they have to choose between employment and healthcare, or employment and direct support. Those are not actual choices. No one should be faced with that kind of inhumane choice. Workers with a disability were nearly twice as likely to work part-time as workers without a disability. And about 31% of those workers with a disability who worked part-time, 31% of workers with disabilities work part-time compared to 17% of workers without a disability. So that's where those numbers come from. And in surveys, the folks with disabilities who work part-time say, I want to work full-time, but they can't find a job or they're intentionally working part-time to keep their income low. Similarly, workers with disabilities were more likely to be self-employed than workers with no disabilities. And typically, self-employment is a positive employment strategy for people with disabilities because we experience so many barriers in the traditional job market. Public sector employment is really important to disabled people. Disabled people are more likely to work for federal, state, and local governments than they are compared to workers without disabilities. And I think that this has a lot to do with the way that those entities understand non-discrimination. And what we're seeing, the cuts at the federal level of the federal workforce are going to impact a lot of people with disabilities, as the federal government is the largest employer of people with disabilities in the United States. People with disabilities typically also earn less when they are working than people without disabilities. Our most recent numbers highlight that on average, people with disabilities earn $13.74 an hour compared to people without disabilities who earn on average $17.73 an hour. I'm going to take a bit of personal privilege and shout out one of our programs. We have one of our alums in the room. Get ready, Samir. AAPD has worked really hard to try to address the disability employment gap through a program that focuses on disabled interns. And on average, the alumni of that program earn $35 an hour. And what this tells me is that when you make an intentional effort to support disabled people and make sure that they can have meaningful career development experience, guess what? We do well, right? And we need more programs like the APD internship program across the country that are willing to invest in people with disabilities. One of the other new requirements in the One Big Beautiful Bill Act are Medicaid work requirements that once again create an extra administrative burden on disabled people who will not only have to prove they're disabled, but prove that they are working to keep their benefits. But it's going to be a catch-22 because if you prove you're disabled, they're going to say you can't work and then you lose your benefits. There are two current threats to disability employment that I want to make sure all of you know about. About 10 years ago, there was a change to Section 503 of the Rehabilitation Act that encouraged federal contractors, which are one of the nation's largest workforces, encouraged them to establish voluntary self-disclosure goals for workers with disabilities so we would know how many people with disabilities worked for federal contractors. And the guidance also encouraged them to establish a hiring goal of people with disabilities at about 7%. Now, I've just gone through a ton of disability data. 7% is low compared to the prevalence of disability in the general population, but that was the utilization goal. And right now, the Trump administration is proposing to remove these requirements. They are also proposing to remove similar requirements for registered apprenticeship programs. Registered apprenticeship programs are proven strategies to help people get high quality jobs and become a lifelong career. And historically, apprenticeships have not been very inclusive of people with disabilities. But a few years ago, they established similar goals to encourage more disability hiring in registered apprenticeship programs. And now all of that is under threat. So if you want to comment on these, you can via the Federal Register. AAPD has a comment that we're open for sign on. And, you know, I have seen now multiple times this year comments coming in that have caused them to at least slow down, the administration to slow down and consider the actions that they're taking. So I hope that you will comment on 503 and help us protect, and registered apprenticeships, and help us protect disability employment. Another really disappointing change that happened this year was that the Trump administration decided not to finalize a rule that would prohibit the payment of sub-minimum wage to people with disabilities. So in 2025, it is still legal to pay people with disabilities less than minimum wage. And in this country, we have about 40,000 people with disabilities who are earning sometimes 35 cents an hour. Yeah. This practice has diminished a whole lot. It was established close to 90 years ago as a way to encourage employers to hire people that people thought were unhireable. But think about how much has changed in 90 years. I wouldn't be standing here today, right? We have technology, we have civil rights law, we have reasonable accommodations, and we have a whole history of disabled people working hard. And the Department of Labor was poised to outlaw this practice at the very beginning of 2025, and the Trump administration has decided not to finalize that rule. So even though that is disappointing, we are still seeing states make important change. In Georgia, this year they passed the Dignity and Pay Act, which bans some minimum wage immediately for employers who aren't certified to do this, and phases out what we call a sub-minimum wage certificate or a 14C certificate by July of 2027. Illinois' version of this act, which also just passed, bans sub-minimum wage starting in 2023. So now 18 states in the country have outlawed sub-minimum wage for people with disabilities. Alabama could be the next. And Kansas is establishing an exploratory committee to figure out how they're going to do this. So that is giving me hope. One of the other things that has really opened up many employment opportunities for people with disabilities is remote work. During the COVID-19 pandemic, when we were still under the public health emergency, we actually saw growth in disability employment for the first time in decades. And many attribute this to the greater availability of remote work. And so for any employer who is in the room or online, I would implore you, please, please continue promoting remote and hybrid employment. It is a real gift to disabled people's experiences. One of the other reasons that disability employment numbers tend to be lower is because education rates of disabled people, or education attainment by disabled people, is also lower. So 1 in 10 or more than 1 in 10 students in public schools in every single state has an individualized education program or an IEP. Over the past decade, the number of students with IEPs has increased by about 1 million. And today, a total of more than 7.5 million students in the US have an IEP. That is not the total of disabled students in public schools. That's just students getting services through a formalized, individualized education program via the Individuals with Disabilities Education Act. We need to understand more about the experiences of students with disabilities. Typically, we see that students with disabilities, around 75% of them graduate from high school. We've made a lot of progress there. That's actually a higher number than it has been in the past. It is still below the graduation rate of students without disabilities. We see a higher dropout rate by students with disabilities. And many states allow students with disabilities to receive an alternative certificate. Sometimes they call it a certificate of completion. About 10% of students with IEPs get these certificates. Florida has recently outlawed these certificates. And I think that's complicated. Many people do not like these alternative certificates or special certificates because they don't have a lot of meaning, right? However, it does make some students eligible for some programs. And so I'm not sure if Florida made the right call there, and I wonder what you think. Most students with disabilities spend at least 80% of their school days in a mainstream classroom. That's a big deal. But we still have a really big number of students who are in segregated schools, segregated settings. And unfortunately, we are still seeing thousands of students secluded and restrained in schools. So of all of the students who were secluded and restrained, 75% of them were disabled. And within that, the vast majority of them were disabled students of color. And so there's a huge intersection of school discipline practices that are currently violating students' access needs and keeping them from attaining the education they desire. One of the bills that AAPD supports is the Keeping All Students Safe Act, which bans seclusion and restraint in schools of disabled students. Talking about some more state progress, Rhode Island has recently codified Section 504's education components into state law. So typically, for students with disabilities, they have an IEP or a 504 plan. And different disabilities, different students with different types of needs can get either or both. And so Rhode Island has made sure that current federal protections for students with disabilities are in their state law. So any changes that happen federally, those students will be protected against. Another state that's given me some hope is Virginia. So I know we have some people with disabilities in the room. For the disabled people in the room, when an emergency happens, what guidance do you get? I'm seeing somebody shake their head, none. Okay, none. The other guidance you get is stay there if someone's coming for you. When I talk to kids and they tell me about their experiences with emergency drills in schools, they tell me, Maria, when I hear that, that makes me think it's okay if I die. And so Virginia just passed an education law regarding students with disabilities and emergency response to make sure that schools and educators have accessibility built into their emergency evacuation plans, and that students can feel empowered to protect themselves when an emergency arises. We're doing our time.
You're good.
Good? Okay. One of the things that has really opened up a lot of education and employment opportunity for people with disabilities is technology. Again, today we have hybrid participants from across the country on Zoom. However, many adults with a disability do not own a desktop or a laptop computer. And adults with disabilities are less likely to go online on a regular basis than people without disabilities. There's also a divide when it comes to digital connectivity generally. Now, I myself am not super motivated to go online when I learn that close to 95% of all websites are inaccessible. The civil rights laws that I've discussed, all of them were passed before we were walking around with supercomputers in our pockets. And by that, I mean our phones. WebAIM, which is an organization that really sets a standard for web accessibility, they recently tested the world's 1 million top homepages. And again, found that 95% of them detected an accessibility failure. And the guideline for accessibility that I'm citing is the Web Content Accessibility Guidelines. This has actually improved because last year when they did this same test, they found that 96% of websites had an accessibility fail. And WebAIM, when they did this test, they tested billions of different elements of web pages. And what they found, and I'm sure what you all experience, is that web pages continue to grow in complexity. And that's great, but it also creates accessibility challenges. So some positive news here is that we have a new standard for websites for state and local government entities. So until as recently as 2024, there was not significant ADA guidance on website accessibility. And now that exists for state and local government websites. And that may sound kind of wonky, but think about all that your state and local government does. That's your public schools, your school board, your utilities commission, right? Emergency warnings, all of that now, if it's online, if it's communicated via Facebook or Instagram, it has to be accessible. And that's exciting, but we still don't have those same requirements for businesses. So major companies, for example, like when you are buying groceries online, those websites right now don't have to be accessible. So think about all of the things that you use the internet for on a daily basis, whether or not it's meeting a direct need, connecting with a friend, or having a good time. Many people with disabilities are cut out of those experiences because of a lack of web accessibility. And it's because technology evolves so much faster than policy. But we shouldn't. Don't you think developers would want to make things accessible because they want more people to use their stuff? We're not there yet. One thing that is creating a lot of disruption for good and bad is artificial intelligence. Many people with disabilities use artificial intelligence to meet access needs, and I'll give you an example. A tool called Be My Eyes allows blind people to do things like navigate a grocery store independently. You don't have to wait for someone to come and help you figure out if this is the right bag of Tostitos that you want. You can use Be My Eyes and it will tell you. That's incredible. Many other people with disabilities use virtual assistants that rely on AI, like Siri or Alexa, to change the temperature in their home or to check the weather outside. That actually is a big deal when it comes to greater independence. However, there are some critical questions that I have, like, what are companies doing with all your data? How are they tracking what you're doing, where you're going, what you're buying? Should you have to sacrifice your privacy for accessibility and greater independence? I think no, but we don't yet have a good foundation for how to make sure that sacrifice is not happening. Many people are using AI to better assess accessibility. I think that that is great. And going back to employment, many AI tools are now being used to hire people, and they are screening disabled applicants out. So I don't know how many folks have recently applied for a job, but some companies are using video interviews, and they're using AI to analyze those interviews. They're evaluating, for example, how candidates make eye contact. If they look nervous, how quickly they are responding to prompts. Interviews are nerve-wracking. Most people in interviews are going to be nervous. But if you are someone who is autistic or has difficulty making eye contact, you will get screened out. Not because you can't do the job, but because AI made an assumption. A lot of people will talk about artificial intelligence tools, algorithmic decision tools, as things without bias, but in reality, they're made by humans. So these tools will have all the same biases that humans do. Before I open it up for questions, I want to talk about two more things. One is voting and civic engagement. Voting is a critical tool for everyone, but especially for people with disabilities. Choice gets taken away from disabled people all of the time. Many times people with disabilities cannot choose when we wake up, where we go, what we eat, or how we communicate. But we can choose who we want to vote for or what ballot initiatives we want to vote for. So individual acts like showing up at the ballot box are often called the great equalizer. And we are working hard at AAPD to make sure that disabled people experience fewer barriers at the polls and can cast our ballots. There are close to 40 million registered disabled voters. That is a huge number. But there is a 7 percentage point participation gap between voters with disabilities and without disabilities. And that is often due to barriers at the polls, a accessible machine not working, barriers with transportation, or threats to mail-in voting. And I want to speak directly to a threat to mail-in voting that was just made last week. The president cannot decide if mail-in voting exists. That is up to the states. That is up to your communities. And many people with disabilities and older adults, particularly older disabled people, really rely on mail-in voting. As we think about what's possible in all these examples and I've shared in my speech, it's clear to me that change happens at a local level. When I talk about voting, and I'm in Alabama, so I have to talk about Bloody Sunday. Bloody Sunday in 1965 led to the passage of the Voting Rights Act, which created many provisions for people with disabilities to have the right to vote. It established the right to voter assistance in Section 208. That is now under threat. There's a lawsuit against it right now. It also established protections for allowing voting in different languages via Section 203 of the Voting Rights Act. Alabama is also the site of some losses in voting rights. The Shelby County Supreme Court decision in 2013, which eroded the Voting Rights Act. So right now, AAPD is strongly supporting the John Lewis Voting Rights Restoration Act, which restores the Voting Rights Act to what it was prior to the Shelby County decision, to prevent a lot of the state-focused voter suppression that we are seeing right now. And we are seeing voter suppression trends at the state level across the board. But again, I want to stress that we have power. We have the ability to determine how, when, and where we want to vote, and we can demand that our voting systems take note. And that's why AAPD will host Disability Voting Rights Act Disability Voting Rights Week between September 8th and 12th. It will include actions around the country. This is yet another example of local impact. Rev Up and Disability Voting Rights Week was established in 2016 in Texas originally, and they asked AAPD to help them out. And last year in 2024, there were over 300 Disability Voting Rights Week events that included disability candidate forums, accessible voting booth demonstrations, and voter registration events. And those 300 events occurred in 33 different states. That's incredible. Again, it's disabled people proving that we are a part of every single community. Another person that I always think of when I come to Alabama is Helen Keller. And when I was growing up, she was one of the only disabled women that I ever heard about, ever. And it was emblematic of how little media representation there has been around disability. One of my good friends, Ryan Easterly, who is from Troy and now runs the WITH Foundation, talked to me a lot about what it meant to be a young person in Alabama with a disability, growing up kind of in the context of Helen Keller's legacy. Because for him, he felt like he had to be high achieving, he had to be perfect in order to kind of count. And that's not true. And thankfully, now we have so much representation of disability, whether it's through the multiple documentaries that have come out within the past year around disability history and the disability civil rights movement. A new one is Change Not Charity on American Experience, if you're interested. There's also Deaf President Now on Apple TV. And we have more shows and films that are authentically casting disabled roles with disabled people. People like Jillian Mercado or Lolo Spencer, both young women with disabilities. We finally, any Broadway fans out there, we finally have a Nessa Rose, a character who's a wheelchair user, finally played by a wheelchair user in Marissa Bodie. And even with this progress, we are seeing a resurgence of the R word. And I can't believe I'm saying that. The R word is showing up on podcasts and in social media. Within 2 days in January, there were 330,000 additional uses of the R word on X after Elon Musk used it once. And earlier this year, the president said in an executive order that disabled people and people with chronic conditions were a threat to the American way of life. And so we have to say that and show people that that is not true. Disability actually is a deeply entrenched part of the American way of life. And no matter what our leaders in power say, we will continue to insist on our dignity, on our value, and on the joy and beauty that is within our lives. When disabled people have opportunities to lead, it makes it possible for everyone to be included. Inclusive communities benefit everyone. And rather than seeing disabled people as a threat to the American way of life, I wish that our political and elected leaders would see disability as a way to move the American way of life forward. So it's up to all of us. And I thank all of you for giving me the time today to join you. Thank you.
Thank you, Maria, for that great presentation. You covered a lot of things that are crucial for us to all know and hopefully act on. So we're going to go ahead and turn it over to questions. I believe this microphone is connected to the speaker, so I can't bring the microphone to you. However, if you have a question, you can raise your hand. Yes, we can repeat it through the microphone. We will also check the chat on Zoom after we take the in-person questions. So just raise your hand if you've got a question, and we will start taking those now.
I've seen you. I don't really have a question. I have a comment on students. When they have IEPs in school. It's supposed to be to educate the child, make sure they get the education. But when you get to the classroom, your teachers, your aides, whatever, ignore it.
Yep.
The student is not taught. So, and they are only sent through the school. My son had this dyslexia, so he needed more to learn. Well, by the time he was time to graduate, he was still reading on a 3rd grade level. Because the school would not, and they said, well, we don't have the resources to teach them. Well, then our government needs to help them with more resources. You know, I mean, it's
all right.
It just, and I look at it this way too. Most of us wouldn't be handicapped if it wasn't for the government and the pharmaceutical companies. Like when my mother was pregnant, she was given pills to keep from getting to losing the babies and stuff. And that comes down to the generations. They need to stop. They need to let us get our life back. They need to quit kicking us in the ass.
I have to repeat most of what you're saying, so I'm going to try to summarize before you go on. What's your name, ma'am?
It's Mary.
Mary, nice to meet you. So just to repeat Mary's comment, especially for folks online, she shared that for students with IEPs, it's meant to educate students, but frequently teachers and aides and paraprofessionals just ignore the IEP, and students with disabilities are in the classroom, but they're not actually learning anything. She shared the example of her son who graduated, who was dyslexic, who graduated from high school at a third grade reading level. And when she said, he needed more, the response from the school, I think, was that they don't have enough resources. And she also shared that the government and pharmaceutical companies are keeping people sick and disabled, and shared the example of her mother who was told to take pills to make babies healthier. But you didn't say
And
this
not
part.
have miscarriages.
And not in miscarriages, but it actually made her sick, and that carries down to the generations. And she said they need to stop kicking us in the ass. Is that an accurate summary?
Maybe it's time for us to kick them in the ass.
I agree. She said maybe it's time for us to kick them in the ass. So I want to comment on at least the first part of what you shared, which is exactly right. IDEA, the Individuals with Disabilities Education Act, has never, ever, ever been fully funded. The closest it's been to being fully funded is 18%. So the schools aren't lying when they say they don't have the resources. That's right, they don't. But they should. And
I have one more comment on that. If they would educate the parents, if they would tell the parents, you need to work with this kid too, because I see too many parents that don't know what to do.
Yeah. So Mary continued that they need to educate the parents because she sees too many parents who don't know what to do. And I think that that's right. There are some programs that do that. But the other thing that happens, and I'm sure you all have seen this, is that we put a lot on schools. When a student has an IEP, sometimes they're not only getting adapted instructional support, they're getting speech therapy, counseling, everything else at school. We haven't actually developed other systems to support youth learning outside of school, when in fact, like, school is just one place that kids are. They're just like disabled people, they're everywhere in our communities. And so anyway, that I'm not going to give you a whole nother hour-long talk, but I think you're right, and we need to fight for full funding of IDEA and be vigilant against particular cuts to education. And I don't know if we have data on how many students basically are in mainstream classes but don't get access to mainstream curriculum, but I'm sure it would not be good if we did.
I have 2 Zoom questions, so I'll do the first one.
Okay.
Let's see. All right. The first one is from Michael Thornton, and his question is that, Maria, you mentioned stats about Arkansas earlier. Where can I find that information so I can share it on my Facebook? Also, I look forward to Power on the Hill the 7th through the 11th of September.
Thanks, Michael. That's Michael Thornton, who is an incredible self-advocate in Arkansas. That data is from the CDC. I can send you, the CDC has a page for every state. And so they have a page specifically focused on Arkansas that shows the prevalence of disability.
Thank you. And I also have another question from Dallas Silva Dunn, who says, many citizens and people with disabilities can often feel that they are powerless in the face of federal or state government or legislative pressure. What would you say is their best recourse for voicing either their opposition or overall opinions on certain executive acts or orders?
So I mentioned one of them. One of them are these comment periods, and it sounds very formal and very, I guess, fancy, but really to put a comment in the Federal Register to tell the government that you either like or don't like what they're doing. It's going to a website and typing in a comment section, just like you would comment on someone's Facebook post online. So that is a great way. The other thing that I want to emphasize is that local local decisions are critically important. If you can, showing up to your planning commission meetings to tell them where they should put accessible sidewalks or more pedestrian support. Showing up to your city's public session to tell your local leaders about how these decisions will impact you is very helpful. I live in Washington, DC, so I do not have congressional representation nor representation in the Senate. But I hear from my friends and family who are contacting their federal elected representatives all the time and not getting much back. But I tell you, it does make a difference. And I'll give you an example. In 2017, when President Trump came into office for his first term, the bill that was meant to gut the Affordable Care Act was introduced January 21st, the day after he was inaugurated. This time, the budget reconciliation bill was not introduced until May. And although, unlike the ACA bill, which we fought and won, and it did not pass, this did pass, but it was still far. It is far less worse. Is that a word? It is not as bad, even though it is very bad, as it could have been. We did not see per capita caps, for example, on healthcare in this one big beautiful bill. They wanted to specifically penalize states that had allowed immigrants to receive Medicaid healthcare coverage, and that was taken out because of feedback from constituents. And so part of what happens when people try to take away your power is they want you to doubt your voice. And one way to get you to doubt your voice is to have people stop responding. But that doesn't mean that you should stop telling them what you think and telling them what you need to thrive. Any other questions in the room? Over here.
Hi, good morning, Maria. My name is Kim Raworth. I'm from the Lakeshore Foundation. John Kemp gives his best to you. My question is in regard, you started your talk around data, but if you can speak to a little bit of now the alterations and lack of funding for data. So whether it be MTAG and disability employment, whether it be ACL and CBDD, some of the centers that actually produce the data that we utilize today, how can we help? What can we do with our voice? And how can we make sure that we track the data so that we know where we are and where we're going?
Yeah, what a great point and question. So the question was basically all of the data that I shared in my talk, all of the entities that produce that data, that conduct that research and evaluation are currently under threat. And it includes entities like the Administration of Community Living, the National Institute for Disability. Hold on, I'm working on an acronym in my head. National Institute for Disability, Independent Living, Rehabilitation Research, also called NIDLR. All of these agencies and more were zeroed out in the president's budget. And all of these agencies have had significant staff that was cut. Similarly, entities that are funded by these federal agencies have also had a pause on their federal funding. And that means that the research and the data collection stops. And that's actually one of the reasons why I spent so much time on data in my remarks, so that at least you all would have a foundation and a benchmark on where things were at before everything changed. So the positive news is that although a lot of these entities were zeroed out in the president's budget, they have not been zeroed out by Congress. So federal agencies get their funding via a process called appropriations. We just went through a big budget reconciliation cycle, and that is actually different than the budget appropriation cycle. So ACL, Administration of Community Living, NIDLR, many of the other entities that were referenced are actually in the Senate's version of the appropriations bill. We have not seen the House version of the appropriations bill, and they could differ a lot. And so it's really important, again, like I just mentioned, that you continue to contact your House representatives, especially to tell them to preserve the Administration on Community Living and all of its programs, because it's those programs that provide essential community support in your states and counties. For example, in my home state, Disability Rights Louisiana, or in another state where I've lived in, Disability Rights Texas, those are all funded by the Administration on Community Living. If that entity has a huge cut to its budget, the services that prevent abuse in nursing homes, that the people who represent disabled students and their families in lawsuits, they will all be fired. They won't have a job anymore. So the appropriations process is really important, and please contact your Congress people, especially.
I have one more question.
There's a woman behind you. I want to check on Zoom.
Zoom is good.
Russo, from Birmingham.
Yep.
Welcome to Alabama, Maria.
Are you related to Emily Russo?
No, but I met you I do some work for the UCD.
Yeah. Oh, that's right. I remember you. Yes.
Yeah. Anyway, piggybacking on what you just said, Adderholt is chair of the appropriations for the House,
Mhm.
and Brett is on the appropriations for the Senate, and she's championing us. Please contact her office. Tell her thank you so much for putting all those things back in with the Senate package, because that is so important. I mean, we're doing a lot reaching out to her office, but everybody, the more voices that stay here matter.
So to repeat that, Senator Katie Britt from Alabama is on the Senate Appropriations Committee and has championed the disability programs that were put back into the Senate version of the appropriations bill. So the recommendation here is to thank your elected officials that are doing a good job. And that is also really important. If you live in a state that your elected officials kind of haven't been a part of making these cuts, telling them thank you, and actually telling them to go farther to highlight what they can do to defend these programs is critically important. Okay, Mary, we're gonna go back to you.
Okay. How do the handicapped people find services? Like if you, it is extremely hard. My son is in a program where he has home health. Well, the people in home health can't give us, he has a bathroom that is falling apart. I've had estimates as low as 15,000. And I know that it can be done a lot less. But because it's called handicapped, they're gonna charge more. There needs to be some way that people can find out what is available and what it should cost and who would do the job.
So Mary asked, how do people with disabilities find services, and shared that renovation for her son's bathroom would cost $15,000, and home health can't recommend anybody to do it. There are some state programs that do home modifications. As you might imagine, the wait list for those programs is often extremely long. There are also some managed care organizations, health insurance companies, that have programs that will do home modifications. And so we would have to have a convert, but a lot of people don't know that. And I didn't know that until I started my current job. Other places for people to find services are centers for independent living, like Disability Resource Network. Do you want to speak to this, Davina? I'm looking at Davina to my right. She's taking the mic, but I think you come over here so the video can see you.
Sure. So Centers for Independent Living, we currently have 4 in the state of Alabama. We are a resource for people with disabilities that are trying to live independently. So we're not a group home, we're not a assisted living facility or anything. We're really here to help people with disabilities to live within their home or the community. So we have contracts with some of the state agencies, like you were saying, the home modification programs, but you do have to be on the community waiver program to get that. And we only cover about 3 counties for us. It's Madison, Limestone, and Morgan County.
See, that leaves us out. We're Marshall County.
Does another still
Yeah.
cover Marshall?
We are the seal that covers Marshall County, but under the
I see.
CWP program, only 3 of our counties are covered. So our center, since we're talking about our center, is underfunded. So we need more funding. So if you guys could advocate for our center to receive more funding, since this is your service area, that would help us to be able to provide more resources and we can have more staff.
Can I make a suggestion?
Sure.
Mary, I know that in Marshall County, NARCOG is a really great resource for.
Well, we do TARDOC
Okay,
and they give us no information. They know nothing. If I was to die tomorrow or on my way home today, my son would be at the house and nobody would know where to go or what to do with him. He has a bathroom that's falling apart.
so that might be a
You know, there's no,
group to reach out to
Okay.
NARCOG, and they've got an office in Decatur. Where do you live?
NARCOG.
NARCOG.
Can you spell that, please?
It's an acronym. It's NARCOG. And it's it's similar to TARCOG. Only it services Marshall County.
Just for folks on Zoom, there was a woman in the audience who recommended to Mary that she reach out to an organization called NARCOG, which is an acronym. It's NARCOG, that services her county. But this is like a perfect example of how difficult it is for people with disabilities to get what we need, because all of these different services, they one often do slightly different things and have different service areas. And so people can just wind up very confused or without support because they happen to live in slightly in a place that's outside of a service catchment.
She's had her.
Oh, I'm so sorry.
I'm not sure about bathrooms, but I know there's an organization called Enable, and they do ramps. And they do other resources, so they may have some information on how to help their local in Huntsville in the United Way building upstairs. The other thing about contacting our representatives, I'm not sure if everyone in the room knows, but Dale Strong will be here tomorrow having a town hall, and it might be a good time to go and ask some poignant questions.
To repeat what you've just shared, another person in the audience shared a resource called Enable that does ramp modifications and may also do bathrooms. In my experience, usually if they do ramps, they do grab bars, at least for bathrooms. And she shared that Representative Strong will be doing a town hall here in Huntsville tomorrow, and that may be a good time to raise some poignant questions and responses.
It's at 6:30 at the Movement Church.
The town hall is at 6:30 at the Movement Church. I'm learning so much about Huntsville right now. This is awesome. I'll be ready to move here in a little bit. Any other questions?
I have a comment from Brandon Wilson on Zoom. He said that the sales program through ADRS can also help with those modification needs.
Okay, what we're talking about is adult.
Uh-huh.
There are no services for adults.
There are federal department and rehab services adults also.
Well, you have to be in the program to know that those services aren't any good. They may have the services, they may say they have the services, but they don't have anybody to help you provide the services. I mean, I can't even get any education on some of the stuff that I need. There's 3 handicapped people living in my house. And it's hard getting to get any information. I mean, you got a full team.
It's true.
And then when you find out who is supposed to help, it's, well, we got a 4-year waiting list. Yeah, so it's time that maybe somebody did something. Of course, if we all got together and went to Washington and walked on up to White House complaining, do you think they'd do something then?
I think National Guardsmen would currently arrest you. I'm not kidding.
Well, he's not living there. I thought he was living in Florida.
It doesn't matter. I live in DC, and I have to see members of the National Guard as soon as I leave my apartment and throughout the metro right now. And our office is near the White House, and there's National Guardsmen all over it. So if you do want to go protest, that is your right. But it comes with significant risks right now. On that note, are there any other questions?
I want to ask you, did you say the quote? Say the president said that, disabled people were a threat.
Yes.
What about Greg Abbott?
What a wonderful question. So in the audience here, they asked, did the president say disabled people were a threat to the American way of life? Yes, he did in the Make America Healthy Again executive order. And she asked, what about Greg Abbott? I think that's a great question. For everyone's awareness, Greg Abbott is the governor of Texas. And he is a wheelchair user as a result of a spinal cord injury.
He's also very rich, and that's why he got where he is.
That is, Mary said he's also very rich, and that's why he got where he
I
is.
was living in Texas, in Austin, at the time it happened.
Mhm.
And the stories that were around are not the stories that got out into the, but a tree hit him when he was walking through the park.
Right.
And from there, he started paying out money, and that's how he got to be governor. And he ran on the thing that he was gonna help the handicapped people. And he has gone downhill with it since he.
So Mary has shared like kind of the story of Greg Abbott, which is that he was running or walking through a park and a tree fell on him. What she didn't say is that he sued and he got a lot of money as a result. And when he, and that's part of how he became governor. And he ran on protecting people with disabilities, and he has not, and it's gotten worse every year that he's been in office. That is what she shared. I will add, Greg Abbott, one of the things that he has done since he's been governor of Texas is actually tort reform, so that people who are injured and become disabled, similar to the way that he did, cannot get those big payouts like he did.
Mercy.
So no one else can do what Greg Abbott did. And it feels very deeply unfair.
Yeah.
And I want to be clear, I'm saying that as Maria Town, not as AAPD.
Well, I will tell you
but-
from experience, I had my accident in Texas.
Mhm.
I ended up with $50,000. The idiot that hit me wanted to be where I was. So he was driving a sewer sucker truck, and I was driving a little pickup truck. And he ran 2 stop signs. And all they would give me is $50,000. And they told me if I didn't take that, I would be out with nothing. And that happened just after Greg Abbott put that through.
Mary has direct personal experience with this. She got, can I describe you to the audience on Zoom, Mary?
If you want to.
Mary is a chair user and an amputee, and she got into her accident in Texas. She was driving a pickup truck and she was hit by a much larger truck who, the driver ran 2 stop signs, and she only got $50,000 and was told if she didn't take it, that she would be just out on her own. And I think there's a question. So she has been directly impacted by the changes that Greg Abbott has made. Jessica.
Yes, there's a question from Zoom that asks about AAPD. It says, what are AAPD's priorities at this time?
I went through many of them in my remarks. We are doing a lot on voting. Again, Disability Voting Rights Week is September 8th through 12th, trying to build the power of the disability vote. We are also working to try to stop these changes to Section 503 and registered apprenticeships. We are currently in the process of monitoring all 50 states to determine how they are changing Medicaid in the wake of this bill. And that's pretty hard to do because Medicaid works differently in every state. The timing will be different. We also do a lot of work on technology, and we are doing some research on the kind of how the Title II rules around web accessibility are changing things. We've also prioritized, again, the Keeping All Students Safe Act. We are trying to get Congress to cancel these cuts. And we have a lot of programs that support leadership development of disabled people. Like I mentioned, our internship program. We also host Disability Mentoring Day, which is the second Wednesday of October. And that program is targeted at high schoolers and junior high schoolers to get connected to a mentor and start participating in job shadowing. Another program that we have is a program that supports emerging leaders and provides emerging leaders with disabilities with funding to execute projects in their communities. And I could keep going, but we are really trying to right now generally protect the civil rights gains and programs that disabled people rely upon, and make sure that there's kind of grassroots organizing infrastructure across the country so that folks can make local change. Back to you.
I've got a question. So, we know who's in power in Washington. We know that they are moving fast to pass all the things they want to pass before next November. They have the majority. And we know that also that speaking with a unified voice is important. What other groups do you work with when you go to Washington and you talk with the legislators? Do you work with other groups like the United Spinal Association or veterans groups?
We work with United Spinal Association all of the time. So AAPD, if you read the words on our website, two of the words that we use are connector and convener. And so we often bring disability groups together to figure out what the agenda will be, whether it's unified or not. Thank you. So we do a lot of work with United Spinal, with Paralyzed Veterans of America, the National Council on Independent Living, National Federation of the Blind, National Association of the Deaf, Hearing Loss Association. I mean, I could keep going. But the groups that we work primarily with are other groups that focus on leadership and lived experience of disabled people. So a group like Special Olympics, they do all kinds of work. We don't do a lot of work with them because they're organized in a very different way, but we often have shared priorities. We, as AAPD, also do a lot of work with groups that are not disability organizations. So for example, we do a lot of voting work with Asian Americans Advancing Justice because we have a shared concern around language access in voting. We also do a lot of work with groups like, sorry, excuse me, Every Library, because libraries are such a central kind of service point for many people with disabilities. And so we would not be able to do a lot of the work we do without doing it in coalition with others. Yeah. I'm good on mine.
Is there any other questions for Maria?
Thank you.
All right. Well, we want to thank everyone for coming out and joining us for this awesome event. We want to thank Maria for traveling from Washington, D.C. to join us. And thank you for that excellent report. I've been taking notes and hopefully you all have. And we're going to be working on some of these issues and still communicating with you to make sure that we're collaborating and partnering and working on reducing these issues in our community. So I want to invite everyone to come out to our fundraiser night tonight at Slim Chickens. It's at 5, it's from 5 to 9. If you want to come out, you can do app drive-through or you can come in and you can meet our team and get you something to eat, get your family something to eat, and yeah, just get some resources. We look forward to seeing you guys tonight. And have a good day. Yeah. Have an awesome day. Yes, ma'am.
So what was the location? Which Slim Chick?
Oh, okay. Slim Chickens, Town Madison. So it's baseball field. Yep. Hope to see y'all tonight. Any
Thank you.
final comments or anything? Thank you so much. You're welcome.